So, ladies and gentlemen, let's move to the next session. Dr. Mukesh Chawada. I would like to invite him. He is a senior manager of healthcare services at Solomix Herbaceuticals Limited, India. He is a clinician with a successful track record of over 2 decades. And with his inclination and expertise in research, Dr. Chawada has been the core of research activities in Sri Dhootapapeshwar Limited, which we are immensely thankful, and the Solomix Herbaceutical Limited. So Dr. Mukesh Chawada would present some fascinating insights on evidence-based authenticity, safety and efficacy of Ayurveda Rasashastra. It's over to you, sir.
Good evening, everyone. First of all, I would like to start my presentation by thanking our Managing Director, Sri Ranjit Pranik ji, for giving me an opportunity to present some of our research data. Okay, now this basically, the forum was on Rasa Ushadis, and Ketan, Dr. Ketan has especially told me that you don't restrict your talk to just Parat Gandak containing products. Okay, you also cover other Bhasma preparations so that we can enlighten the audience what work we have done. Now, basically, as practitioners, okay, majority of practitioners we rely on. So as a practitioners, we always, our basic concern is our medicine should be safe. Whatever we prescribe to our doctors, but our concern should always be that what I am prescribing to my patient, I should know what pharma company is offering me. So this presentation revolves around some examples of authenticity, safety and efficacy in terms of clinical as well as experimental safety and efficacy. And now the era is changing. We are talking of how does the medicine work. So we are also talking of mode of action. Now this is necessary right now because the objective of Ayurveda is broad. Okay, we talk of preventive medicine, we talk of curative medicine, and we also talk of rejuvenative medicines. So we should be able to substantiate it with proofs. Now, when we look at the olden days, what used to happen? When a patient goes to a Vaidya used to diagnose, and Vaidya used to prepare the medicines, and he used to give, and he used to follow up with the patient. Now the era has changed. Right now, when a Vaidya examines a patient, in majority of cases, he relies on ready-made medicines. He relies on ready-made medicines, whatever pharma companies they offer him. And in this process, okay, there are chances of shortcuts. And these shortcuts, ultimately, they lead to reduction in therapeutic deliverables. When we talk of reduction in therapeutic deliverables, it is not just efficacy of the product. It may also lead to toxicity. So we have to be very cautious. And when we talk of safety, when we talk of efficacy, it is joint responsibility. It is not just responsibility of an Ayurveda manufacturer. It is also responsibility of a Vaidya, that whenever I prescribe a medicine to my patient, I should always keep in mind the dose of the medicine, the duration for which I am giving, whether I am giving proper anupan, and lastly, okay, I should never forget that what are the other things like Prakruti, which have to be kept in mind. And keeping this mind, and this is very necessary, because what has happened right now, the Western doctors, okay, they laugh at us. They say that either Ayurveda, here it's mentioned, either it is a placebo or some label it like Dr. Saper. They label it as an toxin. So we have to prove that Ayurveda is not a placebo. Ayurveda medicine, we deliver cure, we are not toxins, provided we are prescribed in proper dose, proper duration, adjuvant and proper diet. So this is the need of the hour. Ultimately, when we talk of research, we have to keep in mind, we have to prove that Ayurveda medicines are effective provided they are used properly. And only effect and no side effect should be our objective. And for this, we require research. I give an example. That on the right hand side we see it is an modern insert. Now in modern medicine or in Western medicine, the insert covers more than 50% of the drug information. So we have to graduate ourselves to that level. Sri Dhootapapeshwar Limited, we have already started it. Now when we look at the insert, we can see they have also mentioned drug-drug interaction. They have that ADME profile. We are talking of toxicity. We are talking of dosage in special population, because these are the challenges which an Ayurved physician what we can say faces daily. Like Madam was giving an example, when I go with a product, okay, they will first ask me, can I use this safely in a pregnant lady? If a person is suffering from HIV, okay, in this HIV patient or in chronic kidney disease, is the medication dosage same or dosage has to be reduced? So all these answers have to be, what we can say, we have to find out the answers. So research is required. So we have to graduate ourselves to the level of Western medicine or even better than that. Now, when we talk of graduation, first thing is standardization. We have to know what is the medicine which we are providing to our patient. Second is safety and efficacy. When we talk of safety and efficacy, it is not just animal safety and efficacy. We talk of clinical safety and efficacy also. And last is probable mode of action. Now, I think in today's our delegate kit, we have inserted one booklet which contains all our research papers, abstracts of our research papers, almost 32 recent research papers we have highlighted. There you can go through it, you can scan the QR code, and you can also download the entire paper which is available on our website. You will understand what kind of work we are doing, and this work was possible through collaborations. And we have collaborated with various institutes in India, and one of our objective of our Sri Lanka visit was also that we should collaborate with Kelaniya University or University of Colombo, so that more and more researches happens. Now I will give an example of standardization. Now everyone knows Suvarna Bhasma, Suvarna Bhasma, Suvarna Bhasma. Everyone is using Suvarna Bhasma in Suvarna Prashan also. Madam was mentioning Swarna Malini Vasant, Vasant Kusuma Karras. Everywhere Suvarna Bhasma is, but manufacturing Suvarna Bhasma is not easy. It takes us almost 30 to 35 days for manufacturing Suvarna Bhasma. We have just enlisted the steps. It starts with procuring the gold bars, converting it into a ribbon. We cut the ribbon. Basic shodhan is done in Kanchanar Quad. Then 1:2:3 is the ratio. 1 part of gold, 2 part of mercury, and 3 part of gandak. Okay. First step is mixing 1 part of gold with 2 part of gandak. We amalgamate it, and that golak, okay, it's kept in a sharav which contains 3 part gandak. Now this process, this entire process, when we give this putter, okay, we heat it to almost 750 degrees. And after heating it for 750 degrees, this process is repeated 14 times. And this takes 30 to 35 days, and the end result is Suvarna Bhasma. So we as a company, we know what we are offering. And what we are offering, I give an example in the next slide. This paper is published where the IIT team had procured these samples from the market, 5 Suvarna Bhasma samples. 1 sample was our sample. It was SBB. Now we know what we are offering, because we are not following any shortcut. If we look at a SBB, which is our Suvarna Bhasma sample, we don't claim that it is nano. Everything is, whatever is nano doesn't work. Okay. Ours was the only sample which contained large size particles to nano size particles. What was important is we have to look at SBC and SPD. Okay, these are also leading manufacturers in India. But if we look at the particle size, somewhere the IIT team, okay, they came to a conclusion that all the particle size are same. If we see particle size are homogeneous, when particle size are homogeneous, it means probably they have not given any Putan Sanskar. It might be procured in a lab or in a furnace. So this is all particles cannot be same, because when we heat it for 14 times at a temperature of 750 degree, temperature increases, then temperature goes down. It is not possible that we will get an uniform size of gold particles or Suvarna Bhasma. So this SBC and SPD, it's a suspicion that they are not prepared as per Ayurveda text. When they are not prepared as per Ayurveda text, we cannot expect results. So this is what we should know. As practitioners, we should know what I am giving to my patient. what pharma company is offering me. So we have to be very demanding. Second comes toxicity. Now, madam had given examples of Loknath Ras, that she has done acute toxicity, she had done subacute toxicity, she has done subchronic toxicity. What they have not done is 180-day toxicity, which they have planned. Now, for this Suvarna Bhasma, apart from characterization, what we have done chronic toxicity. And chronic toxicity, what is the purpose? We give the medicine, madam had given an example, for 90 days or 180 days in 3 different doses. In their case, they had given 4 different doses. One was therapeutic dose, 5 times the therapeutic dose, 10 times the therapeutic dose. Ultimately, the objective is, what is the non-toxic level? It is called as NOAEL, no observed adverse event level. Now this, for our Suvarna Bhasma, was 333.33 milligram. Because as per classical text, the dosage or matra of Suvarna Bhasma is a custom-ansh rati. We had taken the double dose. A custom-ansh is 15 milligram. We had taken a dose of 30 milligram. So 30 milligram into 10 times, so almost more than 300 milligram per day, it was safe. So what does it indicate? That whenever you use Suvarna Bhasma, please do not exceed a daily dose of 333 milligram. Now there are some more examples which I am giving. One is Rasashastra Ras, and second is Swaskas Chintamani Ras. Now why these examples? These are our recent publications. Now these medications, Rasaraj Ras, whenever it is used to treat chronic Vata Vyadhi, or Swaskas Chintamani, when we try to treat lung fibrosis or Tamakshwas, it is not given for 2 days, 5 days or 10 days. It is used for a longer duration of time. So chronic toxicity, this is a basic prerequisite which we should demand. And this we have done. These are our recent 2022-23 publication. And one of the most important thing, madam, for Loknath Ras also you have planned. It is genotoxicity and mutagenicity. Now, for Suvarna Bhasma, we have already published it. Now, I would like to just zoom the slides. Madam, see, this is vehicle control, and next to it is Suvarna Bhasma. We can see intact chromosomes. It is basically a chromosome aberration test. But when a known genotoxic agent, which is mitomycin C, was used, we can easily see there are damaged chromosomes. So this kind of work has to be done for all the Bhasmas which are widely used. So this is proven, this has already been published. And there is one more test, which madam had mentioned. Madam, you spoke of comet assay. Madam, we have done it for our Suvarna Bhasma, and we have done it for the therapeutic dose and 10 times the therapeutic dose. Now, basically, what is the principle of comet assay? We separate lymphocytes, and in these lymphocytes, we look for DNA fragmentation. If there is DNA damage or DNA fragmentation, we can see this image which looks like an comet. Here, cyclophosphamide is a known genotoxic agent which is documented. So we can see this comet-like appearance. But this comet-like appearance was not seen in Suvarna Bhasma treated groups. So it proves that Suvarna Bhasma manufactured by Dhootapapeshwar Limited. Okay, it is not genotoxic. Secondly, Ames assay. Ames assay is the gold standard to rule out whether any chemical entity has that cancer-causing potential. Because in Ayurveda, what happens? It's one of the oldest science. We say health system of medicine. We follow the model of reverse pharmacology. We go from men to mice model. Okay, but in allopathy, they follow mice to men model. So Ames test is very important. If any new chemical entity fails the AMES test, or Ames test I would call, the dossier is closed. That product is never launched because it is confirmed that this is going to cause cancer. So this test also, so it is very unfortunate that for our old products, like Ayurvedic products, now the regulators are demanding this type of data, genotoxicity or mutagenicity, when these medicines have been used for a very longer duration of time. So this is very important. Second is, see, although our director said that you have to cut short your presentation, I might take 5 to 7 minutes extra. So we have proved that it is not genotoxic, it is not mutagenic. And one more thing, it's not just, we have to use some innovative models. Like for Suvarna Bhasma, we had used zebrafish model also. In zebrafish, I would like to just play this video. The left side, we can see that zebrafish, they are swimming at the base of the tank, and on the right hand side, it was Suvarna Bhasma treated zebrafish. Now, they preferred to swim in the upper zone. Now, what does it indicate? It is a sign of non-neurotoxicity. When we talk of, they are very, what we can say, protective. This anxiolytic effect or made the effect of Suvarna Bhasma, okay, increases their risk-taking behavior. So they prefer swimming in the upper zone. Now this has been, what we can say, depicted in the form of graphs also. If we see these graphs, this is the vehicle control, Suvarna Bhasma. We have used comparative control. Now this comparative control is alcohol. Now alcohol is better than Suvarna Bhasma, but it is not a medicine, no. We know alcohol is an anxiolytic, but we had purposely used it. At the same time, we had used caffeine also. Okay, now caffeine is an suppressant. So this fish preferred the lower dose. So this proves that our medicines, okay, these are non-neurotoxic. And if we look at the next graph also, we see on the top, we see that alcohol-treated group, then come this Suvarna Bhasma. Now this graph depicts the height at which they are swimming from the base of the tank. So this proves that these are Suvarna Bhasma is non-neurotoxic. And now when we talk of anxiolytic effect, nowadays everyone knows stress. When cortisol level increases, when stress increases, we are more prone to infections like upper respiratory tract infection. Immunity reduces. So this is one of the benefit of reverse pharmacology approach, where we can interpret the results of these findings. Yesterday we were, Dr. Bhushan Patwardhan sir was talking of rejuvenative potential also. Now this is a classical example. This is Vasant Kusumakar Ras. Okay, Vasant Kusumakar Ras has that tissue protective effect. We say it has an protective effect on pancreas. Now when we talk of Vasant Kusumakar Ras, it is not the medicine to reduce blood sugar levels. No, it is not our objective, because I think Yogesh in his presentation he told that basically the culprit is chronic hyperglycemia. This chronic hyperglycemia leads to end organ damage. When we talk of pancreas, okay, if blood sugar levels are under control, and we are talking of insulin levels also, because when we look into Asian scenario, we have more people who are obese. We are facing an epidemic of obesity combined with diabetes. So the first thing which we have to tackle is insulin resistance. So that insulin resistance is also important, which is very important in tackling the diabetic epidemic. Now we talk of HbA1c level reduction with Vasant Kusumakar Ras. We talk of plasma insulin reduction with Vasant Kusumakar Ras. But ultimately, what is that effect? I would like to show the next slide. This is the immunohistochemistry slide. Okay, in this immunohistochemistry slide, if you look at the center, this is basically a pancreatic section and islet. It is an islet. If we see, you can see some brown dots. Now this brown dots is basically immunohistochemistry. It is SIRT1 expression, silent information regulators. Okay, this SIRT1 expression is very important, because reduction in SIRT1 expression is an indication of organ damage or fibrosis in the pancreas. Now this, when we talk of diabetic control group, where no treatment was given, there is reduction in SIRT1 expression. When we talk of Vasant Kusumakar Ras, that brown dots are very prominent, which are almost similar to the vehicle control group. It means our medicines have that Rasayana effect, and we have proven it through this studies, and that further studies have been done by Dr. Yogesh. I would like to cite one more example. Neuropathy he has already presented. We say that Vasant Kusumakar Ras reduces the progression of diabetic neuropathy. How? By inhibiting the WNT beta-catenin pathway. Now right now US FDA has recommended the use of pregabalin or gabapentin. Now if you look at the article which we have cited, that this is a review article which is mentioned, it's in BMC, Biomed Central, okay. It says, it is 2021 review article, that pregabalin increases the risk of myocardial infarction. Pregabalin increases the risk of deep vein thrombosis. Pregabalin increases the risk of LVH. Now this, whatever adverse events we are mentioning, these are also the adverse events of diabetes. Now when we talk of pregabalin doing this, then no medicine is safe. And Ayurveda has been questioned. But when we talk of Vasant Kusumakar, it has that efficacy which is comparable to pregabalin. But what is the benefit? Sir, pregabalin is not anti-hyperglycemic. Pregabalin is not pancreatoprotective, okay? It is neuroprotective. It is especially used for pain management in diabetic neuropathy. So Ayurveda definitely has edge in this segment. When we talk of our Asian population, first comes pre-diabetes, then comes diabetes. So when we talk of pre-diabetes, it is basically insulin resistance. So we have one more publication where we have studied our formulation Madhumaya Kusumakar Ras, that it what we can say, reduces or reverses insulin resistance. Now why insulin resistance is important? Because when we talk of diabetes, or whether we talk of NAFLD, or whether we talk of polycystic ovary syndrome, insulin resistance is present everywhere. And one of the major thing is metabolic syndrome. What is metabolic syndrome? Is 5 things. No, one is obesity, high sugar, high blood pressure, high triglycerides, and low HDL levels. Now to tackle this, we have to reduce HOMA-IR, we have to reduce insulin levels, we have to reduce triglyceride levels, and this formulation has proven that okay, it works there. And here, if you see, we have taken a allopathy medicine as a comparator, metformin. Metformin does not reduce triglyceride levels. We can see this in the graph. Metformin does not increase the, reduce the LDL levels. Here, Madhumaya Kusumakar Ras or an Ayurveda intervention was better. So we have to, what we can say, think of Ayurveda. What we can say, whenever a patient with pre-diabetes comes to us, no need of giving metformin. Lifestyle modification along with Ayurveda interventions like Madhumaya Kusumakar Ras, patient will definitely improve in terms of what we can say pancreatic protection also. One more example which I would give would be Rudrok Chintamani Ras. Now this Rudrok Chintamani Ras, we are talking of preventive cardiology. No? We are not talking of, we are not competing with allopathy medicines for heart. If I have a heart attack today, you will not take me to an Ayurvedic doctor, or you will not treat me, madam, you will not treat me. Okay, I have to go to some casualty. Okay. Now what happens, this is we should know our limitation. We should know our limitation. Okay, in acute condition, it might be better, but when we talk of preventive cardiology, Ayurveda definitely works. Bruhatva Chintamani definitely works. Now here also, we have seen SIRT1 expression. See, in the Vasant Kusumakar Ras slides, there was SIRT1 expression in the pancreatic tissue. This is SIRT1 expression in the serum levels. And secondly, what we had done, CTN levels, cardiac troponins. So whenever there is myocardial tissue damage, there is increase in cardiac troponin. So here also, we had artificially induced an heart attack by injecting isoproterenol. So TROP-T increase, SIRT1 expression had reduced. There was improvement in SIRT1 expression and reduction in CTN levels. Secondly, chronic fibrosis. What does it lead to? Heart tissue damage. There is cardiac hypertrophy. Now this is a special staining. It is called as trichrome staining. You can see 4 quadrants. First upper one is vehicle control. It is normal myocardium. Next to it we see a blue part. It is basically a special trichrome staining. It will only stain the fibrous part. That blue part is entirely fibrosis. It is disease control. Now when we talk of Rudrok Chintamani Ras or Bruhatva Chintamani Ras, there is reduction in severity of cardiac fibrosis, so less myocardial damage. Now this is very important because I had attended one lecture of a cardiologist. His last slide was this. This is a famous, what we can say, heart transplant surgeon, Christian Bernard. He said that I have saved the lives of around 150 people by heart transplant. If I had focused on preventive medicine earlier, I might have said 150 million lives. This applies to Ayurveda. No, this is what is Rasayan therapy. So we are talking of preventive cardiology. Then comes, now Suvarna Bhasma is over. Now we are also talking of Rasa Sindur and Kajjali. Probably it is almost present in all our formulations. So first of all, we have to clear our queries that our Kajjali or our HGS is different than mercury chloride HgCl2 or mercurous chloride, Hg2, it is different. Now this work was independently done by Indian Institute of Technology, Dr. Jayesh Bellar and team. We had not funded this project. They had procured our samples from the market, and what they found that, okay, HgCl2 increases the cortisol levels, but HGS, Rasa Sindoor and Kajali, they do not increase the cortisol levels. Now, most important thing was HGS. This HGS was lab-made HGS. So when we talk of HGS is not toxic, HgCl2 is toxic. Now we cannot compare HGS with our Rasa Sindoor or Kajali, because in their 2022 paper, they have clearly mentioned that HGS, Kajali and Rasa Sindoor are different. HGS is 50% mercury, 50% sulfur. But when we talk of Kajali, it is alpha HGS, and Rasa Sindoor is beta HGS. Now, these references are in chemistry textbook. This is a very beautiful paper. And secondly, on the right hand side, if you see that graph, HgCl2, there is mercury deposition in the zebrafish tissue. But when we talk of HGS, or when we talk of Rasa Sindoor, or when we talk of Kajali, there is no deposition. There is no deposition. It does not mean that we can replace HGS with Suvarna Bhasma, no, with Kajali or Rasa Sindoor. No, it might, we are talking of safety. It is not toxic, but therapeutically it may not be effective, no, which we are claiming for Rasa Sindoor and HGS. And one more thing which I would like to highlight is, we had done previously 10 years ago work with our regional research lab Jammu, where we could prove that Rasa Sindoor improve the bioavailability of rifampicin. Rifampicin is a very well-known anti-TB drug. It is very toxic, but it is poorly bioavailable. So we have to give it in a higher dose. So in our study, we had proven that it increases, Rasa Sindoor increases the bioavailability of rifampicin by almost 40 to 42%. So this is great, but unfortunately, we cannot launch this product. What will be, it cannot be called an Ayurvedic product, and it cannot be called an allopathy product also. But our products are effective. We say, no, in every formulation, Rasa Aushadhi, we have Kajali, we have Rasa Sindoor. It has its own therapeutic effect, but they also work like an catalyst also. No, they improve the bioavailability of the accompanying drugs. Now, this is a slide many people ask, does Ayurveda work on hormonal levels? Yes, definitely Ayurveda products, they work on hormonal levels. Madam had given an example of Sri Vyadhi Hariras. See, these are the two graphs. I have not mentioned the products. On the left hand side, when we talk of 17 beta estradiol induced oligospermia, there is reduction in testosterone levels, and our Beej Pushti Ras improves the testosterone levels. On the next hand side, we talk of letrozole-induced polycystic ovary syndrome. It is basically hyperandrogenemia. There is increase in testosterone levels, and when we talk of polycystic ovary syndrome, Madam had mentioned in her slide, there was ovulatory dysfunction. Now this ovulatory dysfunction is because of reversal in LH-FSH ratio. Usually it goes hand into hand. So this reversal of LH-FSH ratio is possible through Ayurveda medicines, and we have proven it. Now after this study, we have taken it up for clinical studies, because ultimately what will help Ayurveda is evidence and documentation. Now these are some of the examples of other bhasmas. Like for Asthi Poshak, this paper was published last year. Our principal investigator was Dr. Pawan Godatwar. It was our first project with him, which we had done in NIA Jaipur. Now what happens, what is the edge of Ayurveda calcium over allopathy calcium? See, allopathy calcium is calcium. Allopathy calcium, to maintain or improve calcium deficiency states, it is fine. But this allopathy calcium will not work in senile osteoporosis, will not work in postmenopausal osteoporosis, because their pathophysiology is different, no? Reduction in estrogen levels reduces the bone mass. So where we have to give some medicines which have phytoestrogenic action. Modern calcium will only improve the bone mass, but it will not stop bone resorption. Now through this publication, we have proven that our product, an Ayurveda intervention, Asthi Poshak tablets, improves bone mineral density. At the same time, it also stops bone resorption. Now specific markers are used, bone specific alkaline phosphatase, serum osteocalcin level. These are some of the latest markers which are used. So we are also spending a research. Why? Because to help the mankind. Otherwise, you doctors will not believe us. Means a tradition of 150 years, or when we talk of Ayurveda, 5,000 years old, now this story will not sell, no. People are talking of evidence, so we have to generate evidence. Next is Amla Pitta Mishran. So nobody was ready to take this study because we had published one experimental study in Ancient Science of Life, followed by, after 10 years, in 2022, we had published a paper in GIM, where an endoscopist, where an Western gastroenterologist, he endorsed that your product works. After giving it for 1 month, there was reduction in endoscopic scores in terms of stomach inflammation. At the same time, what we were discussing, it's not just endoscopic changes. When we talk of science, we have to use Ayurveda parameters. So in this study, we had used Amla Pitta symptom rating scale score. Now this classical symptoms of Amla Pitta, avipaka klamotklesha tiktam lodgara gaurave, rut kantadaha arochebesha Amla Pittam vadet bishak. Now these are seven symptoms. Based on the severity scale of 3, maximum score was 21, and we saw that in addition to changes in endoscopic score, there was symptomatic improvement also. So, and this findings we have confirmed through a data of 204 patients. I would quickly conclude. Yesterday, Dr. Bhushan Patwardhan was talking. Why does a product work? Product works because it has a strong pharmacopoeial rationale. When we talk of Amla Pitta Yoga Ratnakar, we talk of Pachanam Tikta Bahalam Pathyam Cha Parikalpayat. This is the Chikitsa Sutra. Now, this Amla Pitta formulation containing Shaktik Bhasma, Bhunimbadikvat, fills perfectly, justifies this Chikitsa Sutra. Secondly, it is basically revalidation of Amla Pitta symptom rating scale score versus what we call today is functional dyspepsia in Western medicine. Then Ayurveda can also play a positive role in IDA management. We have reconfirmed it. Yesterday again, Dr. Bhushan Patwardhan was talking, whatever small studies we do in Ayurveda, we cannot replicate, but we have replicated 2 studies. One was for Amla Pitta symptom, for Amla Pitta, second was for Abralo also. In our phase 4 study, we have proved that our medication, Abraloho, okay, guarantees and HB rise of 2 gram per deciliter in 8 weeks time. Lastly, the second last slide, we were talking of immunity. So we are the first company who have published a paper, and we have not just talked of quality of life, we talked of specific parameters like increase in CD4 count. Now the CD4 lymphocytes are the ultimate cells. Reduction in CD4 cells will lead to opportunistic infection. So we have proven that, okay, our medicines like Swamla, Chavanpras, they have the potential to improve the CD4 count. Thank you.
Thank you very much, sir, Dr. Mukesh Chawada, for that evidence-based authenticity, safety, and efficacy on Rasashastra. So I would like to invite Dr. K.P.K.R. Karunagoda, the senior lecturer and head of the Department of Shalya Prasuti Tantra and Kaumara Brutya of the Faculty of Indigenous Medicine, University of Colombo, to present the token of appreciation. It was a great presentation presented by Dr. Mukesh Chawada. As we all are aware, Dirgha Mayu Smruti Meda Arogyam Paramam Vayam Prabhavarna Shotodara Dehendre Balamparam Vag Pravruti Pulati Kanti Labatena Rasayanam.